I have it. Can you see it?
We can.
Yep.
Yes.
Well, like I said, it's a pleasure to be here. This is the first time I've presented my my program online, and so what I thought I would do is, as I go through my program, I would weave in and out with it the pertinent things to the eClub and leave out those things that may not fit. And so afterward, I'll ask for a rating and see if it was appropriate, if there's things I use that you can't, and so forth. But when I was thinking about my program for clubs, I thought, what in the world could I say in 20, 25 minutes to Rotary clubs that would make a difference to anybody? You know, I thought back on the previous district governors' presentations, and what could I remember from any of them? And I had a hard time coming up with more than 2 or 3 things from my past district governor visits to our club, or as an AG, I perhaps heard them more than one time, so I might remember those a little more. So I came up with a book by Simon Sinek called Start With Why. And it's something that we use for our PE trainings, and we've used it at the District Training Assembly. And basically, with Rotary, what's in it for me? What's in it for you? You know, why are you an eClub member? Why are you a Rotary member? What's in it for you? Because I really don't think that any of us do anything that doesn't have something in it for us. I don't think Mother Teresa would have ministered to the sick and dying in India if there wasn't something in it for her. So I thought this morning I'd share a little bit about what's in it for me, and perhaps that might resonate with what's in it for you. This is Mr. Nguyen, and this is in Thanh Bien, Vietnam, in February 2011. So before I give you Mr. Nguyen's story, let me tell you where this whole vision clinic thing started. And some of you are familiar with the vision clinics that our club has been doing for a number of years. But in 1999, actually, Kurt Wilkening, an optometrist in Medford, and his wife, Tori, went down to visit Project Amigo. And I know some of you are familiar with to see if Ted and his education program down there for disadvantaged children could use a vision clinic to make sure that vision was not a barrier to their learning. So Kurt and Tori went down. They talked with Ted. Ted said he'd love to have a vision clinic. So Kurt came back to our small Rotary Club and said, how many people would like to go to Mexico and do a vision clinic? And so just about half our club raised their hands, which is about 15 of us. So we went to Colima and we did a vision clinic that next year in 2000. And since then, we've done vision clinics in Mexico 8 times. We've been to Vietnam 3 times, Thailand twice, Dominican Republic twice, and I think the team is just getting back from Malawi. Hopefully they don't have too much trouble getting through customs coming from Africa.
Ebola screening, huh?
Exactly, yeah. You know, we were just at the Zone Institute in Victoria, and as we went through customs, they asked us if we'd been to Africa, if we'd been in contact with Ebola. It was interesting. I thought, you know, we're coming from the west coast of the U.S., but I guess it doesn't matter any these days. But Mr. Nguyen was patient 159 on the second day of our Thanh Bien clinic. And for those of you not familiar with Vietnam, Thanh Bien is just about 50 miles southwest of Da Nang, which is kind of in the middle of the country. It's a very rural farming community. And Mr. Nguyen, we learned his story as he made his way through our clinic through our Vietnamese translators. Mr. Nguyen had been a fairly successful farmer in that area. He made about $100 a month, which is enough money for him to own a water buffalo, which in Vietnam, like some other Southeast Asian developing countries, is a tractor. He made enough money for a scooter, and as you know, for many Vietnamese, that's the family car. But he also made enough money to send his children to school. And like Vietnam, like many other developing countries, you have to pay for their education, you have to buy their books, you have to pay for their school uniforms, and you have to provide transportation to get them back and forth for those that don't ride bicycles. In April of 2008, Mr. Wynn was hoeing in his corn patch when his hoe came down on an unexploded mortar. The mortar went off and blew off his right arm and blinded him in his right eye. To make matters worse, Mr. Wynn never could focus his left eye, so it left him essentially blind. So the mechanical skills and other skills that he had, even though he'd lost his arm, he couldn't use. So his children had to drop out of school and go to work on the farm to support the family. So their hope for a better future was essentially gone, because education is the only way out of poverty in Vietnam, like many countries. Well, Mr. Wynn made his way to our clinic in Tan Bien. And as he made his way through the clinic, we examined that left eye, and when he finally got back to the eye doctor, Kurt, he examined him and he brought him back to me, who I was sitting at the computer with our inventory of used glasses that we get from the Oregon Lions. We have about 4,000 pair that we take to each clinic. And he said, "Tim, I think we can help Mr. Wynn." So I looked up his prescription and found a used pair of glasses and put them on him, and he could see. Not only did we provide Mr. Wynn a means for being able to go back to work and support his family, now his children could go back to school, and hope was restored to his family. And what I like to say is Rotary did that. The equipment that we used for that clinic was purchased through a Rotary matching grant. This is an interesting phenomenon that happens during our clinics. We attract children, no matter what country we're in. They just seem to flock to the clinics and want to see what's going on. When I saw this little girl's picture, I had to take it. And as I was reviewing slides to put together this program, I saw that picture and I thought, I got to work this picture into my program somehow. But what it says to me is trust. People just trust us as Rotarians. When we would do these vision clinics, parents would walk in with their children in their arms or holding their hands, and they would just hand them to us, not knowing whether or not we were healthcare workers. All they knew is that we are Rotarians. And with that, I think, comes a huge amount of responsibility to live up to the trust that people put in the name Rotarian. Leanne and I were over in Myrtle Point on the coast, or close to the coast, at the invitation of the Myrtle Point Club. They asked us to come to the county fair this summer and enjoy a wonderful chicken barbecue lunch with them. And we did that, and after lunch, one of the Rotarians invited us to go through the quilt exhibit because she had a quilt displayed. So Leanne and I made our way up to the quilt exhibit, and as we're looking at the quilts, a woman walked up to me and she said, "You're the district governor, aren't you?" And I was a little taken aback, and I said, "Yeah, are you a Rotarian?" And she said, "No." She said, "I was on a GSE team 20 years ago, and I follow you on Facebook." And I thought, holy cow, people, you never know when somebody's going to be looking at you and knowing that you're a Rotarian. I told Leanne later, when we're driving in traffic and somebody cuts me off now, I'm going to have to wave with my whole hand. This is Tom Mustard. He's the president of the Bear Creek Valley Club. This is Blue Heron Park in the city of Phoenix almost 10 years ago. Jackson County donated 10 or 12 acres to the city of Phoenix that was a rubble dump, but it was along Bear Creek and along the Greenway. And the city of Phoenix came to us and said, "Would you help us put in a park?" And we said, "Sure, we'd love to help you put in a park." So we went down and removed the rubble, and then we started raking rocks because we wanted to have 3 or 4 acres of grass. And we couldn't afford to cover the whole thing with topsoil, so we had to rake off the small rocks. So we raked rocks, and we raked rocks. We raked rocks for days. Finally, we were all griping about it, actually, about the number of rocks and how long it was going to take us to get rid of all the rocks. And our retired sheriff in our club, Bob Kennedy, said, "You know, I think the city of Phoenix has a contract with the county jail, and for a minimal amount of money, we could hire the prisoners in the jail on work release to finish raking the rocks. And so I was the first one to raise my hand and offer my $20 to get the rocks raked off. And so we actually did that. But the reason I'm telling you this story is that after having been on these vision clinics and seeing people's lives change with a free pair of used glasses, I didn't really think that putting in a park was going to change anybody's life. I mean, it was a nice park, but I didn't see it changing anybody's life. The park is in now, and in fact, there's another picnic shelter going up as we speak that Leanne has been in charge of making sure it happens. But this past spring, Deanne Eberson, who is the director of United Way in Jackson County, came and spoke to our club. And she said, you know, Head Start is a strong program in our county, you know, the preschool program. She said, but you know, there's not very many fathers involved, and I was trying to get fathers involved, so working with Head Start, we had Dad's Days. And in these Dad's Days, we would invite families, including the dads, to come and do projects with their kids. And they hadn't been very successful. They'd only gotten a few dads. So this past spring, they decided to have a Dad's Day at Blue Heron Park. So they invited the Head Start kids from all over the county to come to the park. And you know how many dads showed up for their kids in Blue Heron Park? 100 showed up for their kids. Blew everybody away. And I thought, you know, we can't judge the projects that we do by our perceived impact that it's going to have on the community. The message in it for me was just shut up and rake the rocks. Projects that we do with the positive intent will have a positive outcome. And I know you've seen that with your solar light project. This is Blue Heron Park. This isn't Blue Heron Park. This is Project Amigo in Mexico. And these little kids are sharing the books that they just got that were donated by Rotarians. They're in Spanish. These children are the lowest socioeconomic group in Mexico. Their parents are migrant workers. They're indigenous Mexicans. This migrant camp before Rotary was just a series of lean-tos that these people lived in. They had no clean running water. It was really pathetic. These kids' parents work in the sugarcane fields. Rotary went into this camp. They built shelters for the families. They put in wash stations so they could clean their clothes. They put in bathrooms with showers. They put in clean running water. But I think most importantly what happened in this camp was they built a 2-room schoolhouse and hired a teacher. The kids' clothes that they're wearing right here, they just received from Rotarians. And the books, again, as I said, were donated through Rotary. After seeing this picture, one of the things that dawned on me was that at the district conference every year, Interact comes together with us and likes to do a service project. But in many cases, it's a token project. It's not a real project. And since so many Rotary clubs do literacy projects, I thought it would be fun to do a literacy project that the kids could get involved in at the district conference. So I invited the Interact kids through their district governor, Libby, who is a senior at Cottage Grove High School, and said, would you like to do a real project at district conference? And she said, we'd love to do one. I said, how would you like to collect children's books and then hand them out at the district conference to underprivileged children? And she said they would love to do that, and so many of the Interact clubs are gathering children's books, both new and barely used, and at the district conference on May 8th and 9th, they're going to be handing out those books to underprivileged children in the Eugene area. The conference is at the Valley River Inn, May 8th and 9th. You may have gotten an email from me suggesting that you get a hotel reservation if you want to come, even though the registration for the conference isn't up yet because that's the same weekend as the Eugene Marathon. And reservations will be tough to come by soon. This is past District Governor Chuck Root and his wife Marty, and this is a Rotary partner project that Bear Creek Valley Club is involved in right now. And our partner is the Junior League women's organization in city of Medford. They buy the food and we stuff the backpacks. We provide 25 backpacks for children, underprivileged children who need sustenance over the weekend for a variety of reasons. When we were doing this stuffing backpacks right before school was out in May, a young man walked in and he said, 2 of these children are mine. He said, I want you to know my wife left me, I just lost my job, and these backpacks make a real difference in our life. And I got to thinking about that, and I thought, well, I'm glad that we're helping make a difference and it's important to your family. But, I was thinking about membership and how, members join Rotary for 3 primary reasons. It's, friendship, community service, and networking. But they stay for community service and friendships that we develop. And I thought, if I had invited a potential member to this service project, then perhaps, they would have heard that and thought, well, this is pretty cool. And then I expanded on that, and I thought, why don't we invite potential members to our service projects? Why are we always inviting them to a club meeting? Because that's such an important reason why people join. So, just a thought, and I know that the eClub is a little different in that aspect, but I know that Emily's involved in our membership rally that's coming up February 7th, and I've been promoting that in my club visits and encouraging people to come, and how we combine our PR, our membership. We take a look at not only recruitment, but retention and engagement, and how we keep members, because that's a key issue for most Rotary clubs. So I invite you to put that rally on your calendars. If you don't already have it, I'm assuming that you do since Emily's in your club, but I encourage you to consider attending that. This is Tina. Tina is a professor at USC in LA. She's originally with her husband Carl from New York City. She teaches film editing, and she has won an Emmy for her work on the TV show The West Wing several years ago. Tina went with us to Vietnam 2 times. The first time when she went, she worked in the dispensary, and that's with all those used glasses. And when you work at that station, you really don't interact with the patients much. And so when we went back to Vietnam, and this happens to be at that same Con Bien clinic where Mr. Nguyen was, Kurt asked her at the beginning of the clinic to do the dilation drops. And he said, Tina, last year you didn't have an opportunity to work with the patients. And this is where, you really get the payoff for the long, hot days that we put in, is working with the patients. And extolled the virtues of working with the patients. And Tina looked at Kurt right in the eye and she said, Kurt, no, I don't want to. And he was like, what? I'd really like you, Tina, to do that. And so they talked about it for a while, and Leanne happened to be standing fairly close. And she said, you know what, Tina, if you'll give it a shot, I will stand there with you, and if you don't like it, I'll take over for you. And Tina kind of sighed, and Kurt looked at her and said, Tina, I don't understand. Why don't you want to do this? And she said, Kurt, I don't like to touch people. And he said, well, would you do it for me? And she said, okay. So Tina put eye drops in people's eyes all morning, all afternoon, and all week. And at the end of that week, we packed up our clinic and we flew to Chiang Mai, Thailand, and we did another week of clinic for the hill tribes near the Myanmar border. At the end of that week, Tina had done eye drops all week again. We gathered for dinner. And at dinner, we debriefed the clinic, and everyone had an opportunity to share their experience. And when it came to be Tina's turn, she stood up again and looked Kurt right in the eye. And she said, "Kurt, you changed my life." And he said, "Tina, I don't understand. What did I do?" And she said, "Kurt, I want you to know that now I touch people. And I don't think that you can do what we do as Rotarians and not have it change our lives. I know that Rotary has changed my life through the projects that we've done and the fellowship, the friendships that I've developed through Rotary. My life is definitely richer than it would have been without Rotary." One last story. Sally Montaigne and her husband Ernie are Rotarians in District 5500. Sally is this year's district governor, and her husband Ernie is actually a past district governor. Their club wanted to do a water project in Africa. So Sally and Ernie did some research, and they identified a club in a village they thought would be good participants for a district match, or for a matching grant at that time. This was a couple of years ago. So Sally and Ernie flew to Africa to meet with the host club to make sure it was going to be a reliable club, because that's so critical in a now global grant, is to have a good partner. Their partner club, the host club, took them out to the village. And Sally said when they drove up to the village, it was noticeably dirty and had a terrible odor. The flies were thick. But as they walked around the village, like the little boy in the pink jacket, none of the children had pants on. And so she asked one of the Rotarians, "Why don't the kids have pants on?" And the Rotarian said, "They can't. They all have diarrhea." So Sally and Ernie flew back to their club in Tucson and wrote a matching grant. The water project went through, and a year later, Sally and Ernie flew back to the village to make sure that it was still functional and that it was being sustained. Sally said they drove up to the village and she was amazed at how much cleaner it was. The odor was gone, far fewer bugs. And then she noticed that the kids were all wearing pants. And the reason I tell this story is because it's only through our donations to the Rotary Foundation that those kids have pants. If you've made a contribution to the Rotary Foundation, you put the pants on those kids. You put the glasses on Mr. Wynn. Through district grants, you helped build Blue Heron Park, so 100 kids in that particular instance could have a closer relationship with their dad for at least a day. With our donations to the Rotary Foundation, we change lives. RI President, or past President, Rick King says that for every $1,000 we donate, we save 4 lives. So I'm encouraging Rotarians this year to make a donation to the Rotary Foundation. Not in any given amount. The President's goals accumulate to $520,000, but that's not my goal. My goal is for every Rotarian to make a contribution to the annual fund of the Rotary Foundation, so that half of that can come back and we can do district grants, and the other half are global grants, or it travels around the world making a difference for everyone.